The upper border of the neck is lower border of the neck. And the lower border is clavicle.
Is it only one point is the border?
No. The lateral border and the inferior.
The lower border is clavicle bone and upper parts of the sternum.
Who can improve his answer?
The lower border is the clavicle. The posterior border is the trapezius muscle from this side, and anterior border is sternocleidomastoid muscle. I'm not sure. Borders.
This skeleton, please.
Just a simple like this.
Нам только этого не хватало новой. You see, the superior border of the neck is mental. Yes, then lower side,
With the thyroid.
lower side of the lower part of the mandible. Then angle of the mandible is here, angle. Then it's an image line from the angle up to the apex of the processus mastoideus.
Mastoids.
Yeah, mastoid process is here, it's here.
Temporal bone.
And then from this process, it's a line, superior nuchal line,
Superior nuchal.
up to the protuberantia accipitalis
occipitalis.
externa. Yes? External protuberance. And as for lower body is an incisura sternis, then clavicle, up to the joints, acromion, acromion joints, with acromion joints, and then image line from these joints up to the spinal process of the 7 cervical vertebrae. Yes, it's a border of the neck. Yes, and what about the division of the neck?
Triangles. Anterior and posterior.
Anterior and posterior, you're right. And this division is
Sternocleidomastoid.
imaging plane,
Yes, ma'am.
which passes through the transverse process.
Yes. Transverse.
Transverse process of the vertebra, yes.
Yes.
And all elements which we will study, organs, soft tissues, are in the anterior part. On the posterior part, we can see only vertebra and the muscles which support
Supported the
vertebra and our. Yes. So, about the division of the anterior part. How can we divide anterior part?
From the
First of all,
sternocleidomastoid.
from the chin
Chin to the hyoid.
up to the from the chin up to the incisura scapula. It's here, incisura scapula. So there is a right
And left.
part and left part. And you may see in the center of each part, we can see these muscles. The sterna, cleidomastoid muscle.
Yes.
And these muscles, these two muscles, divide left and right parts in two. Internal triangle,
Anterior.
yes,
Yes.
and external triangle. Internal triangle
External.
and external. So you can see that two internal triangles joins into the rhomb, yes, into the internal rhomb. Мы задохнемся, если вы это. плохой воздух. Ходит, они сейчас уходят. Yes, two parts, it's a lower side of mandible, and then two parts, it's a sternocleidomastoid muscle. Sternocleidomastoid muscle. А это что?
Я не знаю, вот это.
So it's a large internal room, yes? And this room, and where is your cat? We can see that what
Hyoid.
hyoid bone,
Hyoid bone.
yes, hyoid bone, and this bone divides these
Suprahyoid.
parts into the
Suprahyoid.
upper level and lower level, or suprahyoid
Hyoid or
and
infrahyoid.
infrahyoid. In the suprahyoid part, what we can see?
Muscles.
No, we can see three triangles.
Triangles. Yes.
What triangles?
Digastric.
Submental triangle in the
Submandibular.
center, one,
Submandibular.
and two submandibular. Yes, two submandibular. And in the lower part, we can see we can see the most important triangle.
Carotid
It's a
triangle.
carotid triangle.
triangle.
Yes, from left and from right side. And omotracheal
Omotracheal.
triangle. Carotid triangle will be omohyoidus,
Homohyoidus.
sternocleidomastoidus, and stylohyoidus. Yes, it's here. Yes, and omotracheal is an omohyoidus, sternocleidomastoidus, and midline.
Anterior.
Midline.
So it's a medial part. And laterally, left and right, we can see two triangles. What triangles? Lateral triangle, we call them lateral triangles. Sternocleidomastoid anterior,
Border.
trapezius,
Trapezius.
and clavicle. And omohyoid muscle is here.
The scapula.
Divides this triangle into two parts, omotrapezoidal and omoclavicular. Also, the most important material on the neck is are the fishes. Are the fishes. And how many fishes have a neck?
5.
5 fishes. 5 fishes is the classical 5 fishes. There are 5 fishes, and according to Shevkunenko's, Shevkunenko's division. And you may read about 2 fishes on the neck, about 11, 7, and so on and so on. But Shevkunenko was a surgeon, and he was a very clever surgeon. And he decided to divide the neck according to the surgical structure of the neck. That's why 5 fishes. 5 fishes. You must know the beginning of all fishes. You must know something about what elements are covered with these fishes, and so on and so on. So first fish, you can see it here. It's a superficial fascia, skin, and then will be superficial fascia. Superficial fascia has all superficial layer of our body, there are no any borders of superficial fascia, yes, because it transit from the head to the neck, from the neck to the thorax, and so on and so on, yes. And usually we can see, sometimes we can see everything superficial fascia, yes, without any borders. But sometimes we can't see any superficial fascia because instead of this fascia we can see a layer of fat. A layer of fat.
Understand.
On the neck we can see superficial fascia, and this is not thin fascia as on the lower limb, or the lower limb or the upper limb, and so on and so on. We can see a good dense superficial fascia. Why? Because this fascia includes a very important muscle, platysma muscle.
Platysma muscle.
Platysma muscle. But platysma muscle, this muscle on animal, every animal has a very good and very dense platysma muscle. Why? Because this muscle supports their neck. Yes, because they
The crawling
go
animals.
on four
legs.
limb. Yes,
Four
on
legs.
four limb. But when we begin to go on the two limbs, and the vertebra support our head, yes, that's just from this time, musculus platysma become thinner, and thinner, yes. And now we can see a very thin platysma muscle, but superficial fascia include this platysma muscle. So you must know that this fascia transit from the face to the neck, and from the neck to the thorax. And in all points of our neck, we can see a first fascia, superficial fascia, understand? Then second fascia. Here it is. It's a second fascia. You see, I give this fascia with what fascia with the muscle. What muscle? Sternocleidomastoid muscle, because this fascia forms a sheath for the sternocleidomastoid muscle. And this fascia we call lamina superficialis fascia colli propria. It's a superficial layer of the proprial fascia. So between the first and second fascia, on the second fascia, we can see branches of the cervical plexus. Cervical plexus. This plexus forms from the nerves, from the vertebral nerves, cervical 1, 2, 3, 4. And this plexus has especially sensory nerves, yes? Not long, short, sensory nerve. But you can see one long nerve, and very important nerve, it's a phrenical nerve. It's a mixed of sensory and motor. So you see here, you see the nerves, you see nerves of the sensory parts. This nerve is nervus transversus colli, you see here. Nervus auricularis magnus, it's a sensory nerve for the skin, or anteriorly to the ear, yes? And там маленький, nervus там auricularis minor to the skin of the occipital part, yes, occipital part. And then 3 parts of nerves to the clavicle, subclavicle nerve. Да? And this nerve is median to the sternoclavicular joint, then to the center of point of clavicle, it's a medial, and then to the clavia acromialis, lateral. Yes, this is the sensory nerves, and this nerve supplies mammary gland. Yes, the skin of the mammary gland, especially along the line which passes through the center of the nipples. But you can see vena jugular, external jugular vein here, yes. And very important fact that all these plexuses appears behind the sternocleidomastoid muscles in the midpoint of the posterior side of the sternocleidomastoid muscle, except of one nerve. This nerve is not a plexus. Here, nerve. It's an accessory nerve. Yes, accessory nerve. What pair of the
11.
11. You're right, 11. Yes. So all these elements you can see on the second fascia, and then will be third fascia. Third fascia, it's a deep layer of the proprial fascia. Yes, and this fascia appears from the hyoid bone, and then passes downwards to the sternum and clavicle. But second fascia attached to the external part of the sternum and clavicle, and third fascia attached to the internal part. That's why clavicle and sternum, the joint, not only joints, but these between these fascia includes sternum and clavicle. Yes. So you must know that third fascia, we call it a trapezius of the neck. Why? Because the form of this fascia like a trapezium. Superior hyoid bone, and then a lateral part, it's omohyoid muscles. Yes, omohyoid muscle, left and right. Yes, and then internal part of the clavicle and sternum. So this fascia includes such muscles as sternocleidomastoid. It's the longest muscle. Then sternothyroid means thyroid cartilage, yes, and then thyroid. I will try to show you thyroid. Yes, thyroid is here. Is here. It's a very small muscle. Thyroid muscle. Sternothyroid and thyroid. So it's a third fascia, and then fourth fascia. Fourth fascia is a very important fascia because this fascia, first of all, it has 2 layers, external or parietal layers, and then internal layers, visceral layers. When I say neck, какую фигуру я имею? Какую фигуру вы себе представляете? For example, kidney is like fasole. Yes, heart has a special. And what about neck? It's a cylinder. Yes, cylinder. Truba, tube. It's a tube. And this tube has external part it's a walls, yes, and internal parts it's on organs. So third fascia, fourth fascia, inline the walls of this tube, yes, and then on its posterior part it transit into the visceral part, a part which cover the part which covers all organs, yes. So it's in only one fascia, but it divides into two parts. Yeah? So this fascia, you see a visceral part of this fascia, yes, on the thyroid gland, on the larynx, you see here on the larynx, then on trachea and so on and so on. And with parietal part, the posterior задняя часть, задняя площадь of the muscles, tracheal muscles, lie on the parietal layer, on the parietal layer. So deeper than these organs, we can see a vertebra. You see here vertebra. You see here vertebra. And our vertebra is covered with the fifth fascia. Fifth fascia, it begins from the large occipital foramen, yes? And it looks like trapecia too, but it passes downwards on the neck, on the thorax, on the abdomen, on the pelvis, and so on. Yes, that's why we can see this fascia in all parts of our body. But in the cervix, we can see it as a fascia, fifth fascia, and in the thoracic part, parts of the endothoracic fascia, then parts of the abdominal and the pelvic fascia. So it's a fifth fascia. It lies on the muscle, on the neck, it lies on the muscle, musculus longus capitis and longus coli. So this fifth fascia forms a sheath for the deep neurovascular bundle. It's a subclavian vein, artery, and plexus, brachial plexus. And fourth fascia form the sheath for the general neurovascular bundle. Arteria carotis communis, vena jugularis interna, and nervus vagus. So there are fascias, and these fascias form in fat spaces on the neck. And it's very important, fat spaces, because except of fat we can see sometimes nerves, veins, arteries in these fat spaces, yes? And all inflammations and phlegmons of the neck forms just in these fat spaces, yes? So, about fat spaces. Superficial fat spaces, first, it's a spatium interaponevroticum suprasternale. Second fascia, external part of sternum, and third fascia, internal. That's why between these two fascias we can see a fat spaces 2 or 2.5 centimeters upper than in caesura sterni. We can see this fat space, and in this fat space, except of fat, we can see veins. These veins form arcus venosus juguli. Arcus venosus juguli. And so this first fat space. And when the patients in the abdominal, ну, он нормален, он не болен, да? This fat space is observed. But when we can see an inflammation, this fat space become wider and open to the next fat space, blind sac. This blind sac, or Gruber's sac, is situated between the second and third fascias, along the clavicle, yes, behind sternocleidomastoid muscle, behind. So there are no any elements except of fat in the blind sac. But this blind sac during the inflammation can connect with intra-aponeurotic sac. And then the third will be the fat space of the sternocleidomastoid muscle, because second fascia forms a sheath for the sternocleidomastoid muscle, and there is no anything except on this muscle in this fat space and fat. Yes. So during the inflammation, this fat space can connect with blind sac. Yes. Then the fat space of the trapezial muscle. It's a second fascia, and this second fascia covers the trapezial muscle, and there is no adhesion except of muscle, and this fat space is observed. Then the fat space of the submandibular gland, because second fascia forms the sheath for the submandibular gland. But submandibular gland has the ducts, arteries, veins, nerves, which exit from this sac, yes, and enter this sac. That's why it's a fat space which connects with the oral cavity. So then, between the parietal and visceral part of the fourth fascia, there is a pre-visceral space. But more often you can read that it's a pretracheal space. Why? This fat space begins from the hyoid bone up to the incisura scapula, but anteriorly to larynx, it's a very, very narrow fat space. And here near the thyroid gland, it's a very narrow fat space, but anteriorly to trachea, these fats become wider, and there are a lot of fat. And in this fat space, we can see, first of all, and venal plexus of the thyroid gland. Then, and it's a very important fact, in the childhood, early childhood, and then the childhood, we can see veins, and this truncus, cervical trunk. It's an arterial trunk from the arch of aortic arch, and that's why when we perform an operation, especially in the childhood, we can catch it, and immediately will be death. Why? Because the blood pressure in this vessel is very high. So, and 30% patients has an artery which we call arteria thyroidea. What does it mean, ema? The most lowest artery, yes? and this artery is a very small, yes, small, but it exits from the aortic arch and then to the thyroid gland. And this, if we cut this artery, blood pressure and bleeding and тоже death. So it's a pre-tracheal or previsceral fat space.
Yes.
And posteriorly to organs, we can see a retrovisceral fat space between the fourth and fifth fascia. And this retrovisceral fat space has only fat. But this pre-tracheal part connects with the thorax, with anterior mediastinum, and retrovisceral connects with the thorax, but posterior mediastinum. Yes. Then will be the prevertebral fat space between the fifth fascia and vertebra. And this fat space spread from the occipital part through the neck, through the thorax, abdomen, and so on and so on. And this fat space, the inflammation in this fat space can spread and passes downwards, upwards, downwards, upwards, and we call such abscesses we call cool abscesses. Cool. Why cool? Because you know that all abscesses have a high temperature. Yes?
Yes.
And there is no high temperature during these abscesses. That's why cool abscesses. So laterally we can see a neurovascular fat space, neurovascular number 1. It fourth fascia, parietal layer, forms a sheath for this general neurovascular belt, such as common carotid artery, internal jugular artery, and vagus nerve. This neurovascular shell, neurovascular shell. Ну, я сейчас вспомню. Эта щель, it connects with the cerebral cavity and этот самый anterior, средостение, anterior, переднее средостение. Not pericardium, but средостение. Средостение. What does it mean, средостение? So, in the thoracic cavity, we can see two pleural sacs, left and right, for lungs. And between them, there are mediastinum. Mediastinum. It's organs which located in the central part of thorax. It's a heart, it's an aorta, then esophagus, yes, esophagus, then venaicus, demiascus. These complexes of organs are mediastinum. So, and this second neurovascular bundle with fifth fascia form a fat space which connects to the axillarian cavity and then to the upper lip. Yes, upper lip. In the lateral triangle, we can see two triangles, omotrapezoidal and omoclavicular. In the omotrapezoidal triangle, we can see first, second, and fifth fascia. Yes, and between the second and fifth fascia, there is the fat space of the lateral triangle, and in this fat space, we can see such important neurovascular bundle as suprascapular, yes, arteria, vena, and nerve suprascapular. And this neurovascular bundle supplies the suprascapular muscles, and this neurovascular bundle, along the way of this neurovascular bundle, the inflammation can spread from the neck to the skin. So it's a fat spaces, yes. And then something about submental and submandibular triangle. What can you tell? Can you tell me something about submental triangle?
There are two types of triangle here. First is the submental triangle and the digastric triangle. Two triangles. And the
Three triangles: submental and two submandibular.
submandibular.
What about submental triangle?
Submental triangle. Apex is from the middle. Apex is on the mental line. This line, and its base goes to the
It
hyoid
seems
bone.
me it's a chin. It's the apex of this submental triangle,
Yeah.
and then the base of this triangle
hyoid.
is hyoid bone, and laterally two muscles, musculus digastricus.
Digastric muscles.
Digastricus,
Anterior.
the anterior belly
Digastric
of the
digastric
digastricus
muscles.
muscle is here. Yes, and in this triangle we can see and then thin skin, yes, and superficial fascia, and then a very narrow fat of layer, and then will be a second fascia which covers these digastricus muscles, and deeper will be very important muscle, mylohyoid muscles. And these muscles is a diaphragm of the oral cavity.
Oral cavity, floor of
That's
the
why there is no foramen in our oral cavity, yes. And deeper we can see two muscles, just
glenohyoid, glenohyoid, glenohyoid.
Я по-русски уже забываю слова, не по-английски. It's hyoid bone and chin, yes, between these two elements.
Hyoid, glenohyoid.
Hypoglossal.
अगर तो बस लग होता है
Yeah.
तो बस लग होता है
From the chin to the hyoid bone, and deeper from the chin to the tongue. Yes.
my
So there is no any vessels here.
glenohyoid,
Huh?
glenohyoid.
Ну, я сейчас...
Glenohyoid, mylohyoid is ये दोनों का फ्लोर बनाते हैं मतलब ओरल कैविटी का
Hyoglossus is the deepest muscle, theoglossus. Huh? Not. It's a
Muscles.
mistake. It's a hyoglossus, but it's like laterally. Huh? Genioglossus and geniohyoideus. Oh my God. Geniohyoideus, two muscles, geniohyoideus, and deeper genioglossus. Yes, genioglossus. And hyoglossus is a muscle which lay laterally from the midline of the submental triangle. And the most important is the submandible triangle. Submandible triangle, it's a triangle, lower side of mandible, and two bellies of muscle, digastric muscles. And we see that in this triangle we can see a submandible gland.
Glands.
It's a very important
small
gland,
gland.
yes? And here it is. And this gland
Big space. covers.
is in its sheath, second fascia from this sheath, yes? And near the second gland in its sheath, we can see a lot of fat. In this fat, a lot of lymph nodes and lymph vessels. And we can see an artery. This is a facial artery. This artery passes posteriorly to this gland, and anterior to this gland passes vein, the facial vein, and in this sheath we can see a very small nerves. These nerves is the fifth part of the facial nerve. You know this nerve? Holy nerve, yes, for the platysma muscle, And how many branches has facial nerve?
5 branches.
5 branches.
Temporal.
First temporal, but is not for temporal muscle, because temporal muscle is a masticate muscle. For the frontal muscle, then zygomatic, then buccal, marginalis mandibuli and poli. Yes. So it's you must know that the fat in the sheath of this gland, it's a first stage for metastasis for all cancer on the face. It may be skin cancer, it may be cancer of the soft tissues, it may be cancer of the maxilla and mandible, and the lip, especially lower lip tongue, and so on and so on and so on. So during such disease, we can see that the capsule of this gland, and it increased. Yes, it increased, and then these vessels, lymph vessels, along these vessels, metastasis pass to the neck, to the deep lymph nodes of the neck. So it's a submandible. And then we will study a very important triangle. What? A carotid triangle. You see, this carotid triangle posteriorly will be sternocleidomastoid muscle, inferiorly is omohyoid muscle, and superiorly digastric muscle. You see, this is the carotid triangle. First of all, skin. Then, what fishes can you see in the carotid triangle? First fissure, second fissure. What about third fissure? There is no third fascia in the carotid triangle because the lower, the side of this is the lower part of this triangle. But fourth fascia will be in this triangle, and this fourth fascia form the sheath for the general neurovascular bundle, such as carotid communis artery, jugular vein, and vagus nerve. You can see that along the level of the hyoid bone or of the superior part of thyroid cartilage, we can see that artery, common carotid artery,
to the left and external internal.
is divided into
Two parts. Anterior,
External and internal.
Internal.
You see that internally we can see external
External.
artery and
Posterior.
external internal.
Internal.
Why? We call them external and internal. External because this artery gives branches for
the
the
face,
external part of
the
neck
neck
and
and
face. And internal
Goes into the
for the cervix, yes. And this is external and internal. Then this vein, internal jugular vein, is very important vein because the blood passes from the cavity, the cranial cavity, to the neck, and through the neck to the heart, and so on and so on. And vagus nerve, it's a parasympathetic.
parasympathetic.
And on the external base of crani, vagus nerve, it exits from the base of crani, from the cranial cavity, from the foramen, jugular foramen, yes?
Foramen.
And then this nerve, firstly, immediately gives us a laryngeal superior nerve. And I'll try to show you superior laryngeal nerve is here. Yes, superior laryngeal nerve. And then lower it gives us an inferior. But in the triangle, carotid triangle, it's a superior carotid nerve. But I remember to say some words about Pirogov's triangle. In the submandibular triangle,
Yes.
we have a small triangle. Here it is. It's a Pirogov's triangle. Pirogov. Pirogov, many years ago, Pirogov was a military surgeon. Yes, military surgeon. And under the bullet on the battlefield, he performed this his operation. Yes, and the injuring of the artery which passes to the lingual artery. Yes, sometimes we need to перевязать artery. Yes, завязать.
Tie.
Tie.
Ligate.
But where we will find it? We will find it not in the oral cavity, because in the oral cavity there are a lot of veins, nerves, and it's very hard to find it. And that's why we will find it on the neck, in the Pirogov's triangle. You see, in this triangle has a lower side. It's a tendon between the musculus digastricus superior, anterior and posterior. Yes. Then it will be. Excuse me, please. It will be a 12 pair of nerves. Hypoglossal nerve. And anteriorly it's a milihyoid muscle. That's why there is a foramen, and in this foramen, the bottom of this foramen is hypoglossal muscle, yes? And we must separate the files of the hypoglossal muscle, and you will see a lingual artery, yes? And you must know that the duct of this gland, the duct of this gland, lungs exit and enter to the oral cavity. And superiorly to this duct, we can see nerve, lingual nerve and lingual vein. And inferiorly, it's a lingual artery and submandibular nerve. Submandibular nerve. So, in the carotid triangle, we see that common carotid artery lies medially and superiorly than vein, medially and superiorly, and vein laterally and inferiorly, and between them, posteriorly to these elements, we can say a vagus nerve.
Vagus nerve. Yes, it.
And deeper, we can see a fifth fascia, and if we separate this fifth fascia, we can see sympathetic trunk with third and second nodes. Yes? So it's a carotid triangle. And I want to tell you some words about lateral triangle. Lateral triangle is sternocleidomastoid anteriorly, trapezial muscle posteriorly, and clavicle inferior. Omohyoid muscle, its posterior belly, divides this triangle into two parts, omotrapezial and omoclavicular. In the omotrapezial, we can see skin, first, second, and fifth fascia only. Between the second and fifth fascia, we can see a fat space, and in this fat space, we can see a neurovascular bundle, subscapular. Suprascapular, it's my mistake, suprascapular. Yes, and in the omoclavicle, we can see first, second, third, fourth fascia, and first, second, third, and fifth fascia. Yes, and just in this triangle, we can see in its deepest part, we can see a deep neurovascular bundle inferiorly and anteriorly to all these bent vein, then upper and posteriorly artery, and upper and posteriorly it's a plexus, yes, brachial plexus. So this is all material for today. And for tomorrow, you will prepare deep part of the neck and all organs and topography of the carotid and subclavian artery. Yes, you must bring pen and you must bring your copybook. So packed this.